more than 80% of the population is affected by acne.
I didn't want to talk about it, really.
I mean, it affects your mood.
Acne
Actually hurts.
In fact, it is the most common condition that dermatologists treat.
Cleocin T,
Accutane,
retin-A,
orthotricycline,
special soaps.
Existing therapies often do not meet patient expectations.
I've tried everything.
nothing was working.
Because I would still have occasional breakouts.
Very depressed.
It just didn't work for me.
And now, Candela, the world's leading medical and aesthetic laser company, offers a new option without the side effects and compliance issues of traditional therapies. Smooth Beam, a new effective treatment for acne.
Smooth Beam is a new laser treatment that actually goes to the root of the problem. It targets the sebaceous or oily glands that are the root cause for acne.
What the Smooth Beam is doing is sending in a wavelength of light that actually heats up water. Now, the top of the skin is protected by the dynamic cooling device. At 1450, it seems to be just about the right wavelength to get the depth of penetration we want to see to get the maximal damage to the sebaceous gland.
Patients can find traditional treatment to be complicated.
People, after a while, get quite ornery about taking these medicines.
The creams would just dry up my face and just make me break out more. So I just stopped doing it. And it wasn't helpful.
They're tired of having to take all these medications for acne. So it becomes a problem. And then compliance is affected. They don't want to do it very much anymore. And they eventually just get tired of the treatment and they'll leave their acne go.
So then that's when I did the Smooth Beam laser, and after that, I mean, it was, like I said, amazing. I couldn't believe the difference.
While acne is not life-threatening, it certainly can be life-altering. It is especially problematic for teenagers, who often suffer lower self-confidence as a result.
We have many younger adolescents who are brought in by their parents having failed over-the-counter products and some prescription topical therapies, and their parents don't feel comfortable with starting them on oral antibiotics, which may require years of therapy.
Well, my mom didn't really believe in like a really strong medication.
There were drugs you could take, also surface things that you could apply. None of them were particularly effective.
I would get nosebleeds basically like every day, because it would just dry up your entire face.
There are a lot of issues with Accutane that, whether they're real or not, certainly the general public, the lay public, hears them.
Every side effect that they basically had listed on the medicine, I basically got.
So a lot of people are leery of taking Accutane. These are typically the patients who come in for treatment with the laser.
Acne often strikes when hormonal changes are at their peak, but there's no timetable for acne.
I'm 32 now, and I'd say I started having problems maybe 25, 26.
We see acne actually developing more commonly these days in older and older women.
Growing up, when most people had skin problems, my skin was fairly clear. And then I began getting cystic acne.
Whereas it used to be basically a problem of adolescence, women now in their 20s, 30s, 40s who never even had acne before are developing this problem.
It's that time in your life when you're actually starting to get wrinkles and you feel like you're in the clear, and then all of a sudden I got slapped with some pretty major acne.
They're very interested in having the laser treatment. They don't really want to be on antibiotics. Their lives are very busy. They don't want to deal with topical agents. The laser fits in perfectly with their lifestyle. Well, we're going to treat the acne today, but I think we could also help you with the acne scarring. And the nice thing about this laser, it'll even soften the lines on your forehead, too. So you get 3 benefits.
The energy from the laser is going into the dermis to heat up specifically the collagen and other elements that comprise the dermis. The new skin that forms in response to that wound is improved on the surface by either minimizing the appearance of a scar, or in the case of wrinkles, by minimizing the appearance of a wrinkle.
If a patient has acne scars, certainly they improve, and if the patient happens to have wrinkles or texture irregularities, they also improve. So the patient can get a lot more than just treatment of their acne.
With most topical or oral therapies for acne, it may take 1 to 2 months to see any degree of improvement.
With the Smooth Beam, doctors are reporting positive results early in the treatment cycle.
What's exciting about Smooth Beam treatment is that we can see improvement usually after the first treatment session.
And Smooth Beam laser treatments are convenient, quick, and easy.
The great thing is that there's no downtime. So people can come in, have a treatment, and they can go right back to the office. So for most people, this is a great lunchtime treatment. We are seeing great results with the Smooth Beam.
Most patients are achieving greater than 75% improvement in their acne.
Well, the response so far to Smooth Beam has been very exciting.
Smooth Beam is quite effective.
Smooth Beam really leads the pack.
The best thing is I feel comfortable about tying my hair back now.
Very, very, very happy.
The results are amazing.
I recommend it.
I was pleased with the result.
It makes me feel a lot more self-assured, you know, to know that I've kind of got a handle on it.
Smooth Beam is allowing us to attack it from another angle, and there are a lot of patients who are failing all the other possible treatments who are actually responding to this. So it's been a real help in our treatment of acne.
Smooth Beam from Candela, the new effective treatment for acne.